Welcome to this week's episode of Promising Young Surgeon. This week we dive into a vitally important but sensitive subject, sexual assault in medical training. Dr. Mel Thacker joins me today to share her own story. Allow me to please introduce our guest today. Dr. Mel Thacker is an ENT surgeon and coach. She practices in Worcester, Massachusetts, double certified in otolaryngology and lifestyle medicine, and she's fellowship trained in rhinology. She is also the creator and the host of the Surgeons with Purpose podcast, which is for surgeons who feel like their careers are not as fulfilling or prestigious as they expected. She's married to her best friend, who works as a tennis and golf coach, and they have two children, age 8 and 10. And a pet bunny named Daisy. She's a retired marathoner, having completed 20 marathons and took first place in one. Hi, Mel. Thank you so much for being here today. We're so excited to learn from you and from your experience.
Hi, Frances Ray. Thanks for having me. Do I see a puppy in the background?
Oh my gosh. Maybe. Yes.
So cute.
He's always skulking around. He's a good guy. His name is Beignet, like the donut.
Oh, I love it.
From New Orleans. Yeah. So if you hear like the click clacking of fingernails faintly, like, yep, then he's doing his securing the perimeter of the home.
Nice.
So today I'd like to open with a story that you shared with me that really sets the tone for the discussion today.
Mm-hmm.
So back years ago, when Mel was at an alumni event at her home training institution, she was at one of those large gatherings. And one of the attendings that she knew, then head of the department, he came over to her and he pointed somebody out. So he points over at a woman in her 60s and says, "Hey, let me tell you a story about her." Guys, this is so common. I knew tons of guys like this. This is like the old guy move for attendings. They're always like at a party. They're trying to rustle up some tea, get the people going. And so just hey, let me tell you a story about her. And he continues, "She's a feisty one. She got us to get our own call room. She literally spearheaded the male and female call rooms because she said she wouldn't stay with a man in the call room." So, of course, you guys finish up that conversation. And then a few minutes later, when you walked over to introduce yourself to that woman, said, "Hi, Dr. Smith told me about you. He said that you spearheaded the male-female call room." And she replied, "Yeah, I did, because I was raped by a co-resident."
Yeah.
And what was your response when she said that?
I was shocked. I was just floored. And also I felt kind of awful for trying to connect with someone like in a lighthearted way and then bringing up such a trauma from her past. But it was also very eye-opening.
I think that it says a lot, and I can really, again, like this scenario feels so real. Like I can picture where the person who shared this story with you, of course, like they left out a fairly integral portion of it. And moreover, it was turned into this kind of sinister thing, right? Like it was flipped on its head where, well, she's feisty. Feisty, interesting choice of words for that, but like she's feisty. She made us go through the inconvenience of separating male and female call rooms back in the day.
Mm-hmm. Yeah. And I mean, I think of, when we were talking earlier, we were talking about how this particular attending, this particular leader almost went from somebody who was very malignant, or at least was perceived that way from what I'm told. I didn't know him at the time, obviously, but then he became someone who was very grandfatherly. And his main objective, it seemed like, would be to like connect with people and like tell stories and, just kind of exactly, tell stories. Right. And so I think he was just trying to do that. And that was one. And it was fascinating for the fact that he didn't understand what was happening. And he thought of that as like a lighthearted story, when actually it was a very heavy, heavy actual thing that happened under his foresight, like under his oversight, and he had no idea what was going on in the background. I thought that was just fascinating.
Yes, that's a great point. It does say a lot, and it breaks my heart. I cannot imagine how isolating that was for her, especially to then have to advocate for yourself and just, try to make the argument, well, why should I, a woman in surgery, get my own call room?
Right. Yeah. And I don't even know what the argument was that she made. Who knows what was said, but she fought for it and she put her foot down. It was like, I would leave this program, I think is what she told me, if it didn't happen. And so she made it happen.
Incredible. Well, the other thing that I think it's really important to remind everyone, right? This woman is not very old. She's not much older than us. We're not talking about some faraway time like, 8 generations ago, 20 generations ago, this crazy thing was happening. It's like this, certainly informs, I think, our generations to an extent, but certainly those who came like 1 or 2 generations before us for women in surgery.
Yeah, absolutely. And it also speaks to kind of like the stress that we're under and how I think everyone in residency, at least maybe there was a time, maybe it's still it's the same way. I'm 11, 12 years out, but everyone's just trying to feel better. And it's like you go through so much pain and, the primitive brain wants to seek pleasure, avoid pain, and conserve energy. And so there is almost like this like seeking of pleasure that happens, right? And it can happen in a way that can victimize certain people. And whether, that is absolutely happening out there, and it's happening every single day. And I would guess it's still happening to this day.
Absolutely.
Yeah.
Well, I would love to turn things over to you for you to share your story with us. I really appreciate you being here. This is always a safe space, and your bravery in speaking about your experience, I know it changes my life and those of many other female physicians, hopefully male physicians as well, who say, okay, I'd never thought about things from that perspective before.
Yeah. So I'll just tell you the whole story. Okay. So for me, I was a 4th-year resident. We had just taken our in-service and we went out to celebrate and had like drinks and went out. I think we went out for dinner. Maybe we didn't. But that all happened. Everybody kind of dispersed. And then a small group of us went out to another like bar. And what I remember was meeting a couple of 2 guys in particular who had been visiting from another country. They were there they're engineers who were there for like a couple of months, contracted work in the US, and they were staying in some housing. And so I said, hello, we started to chat. I remember talking to one of them for a little while, and then he was like, hey, do you want a drink? And I'm thinking, I'm like a 32-year-old woman or 30, however old I was at the time. I just completely forgot all of the advice that they tell you in college. And I was like, oh yeah, sure. And he went and got me something and brought it back. And we cheersed and I took a sip. And then the next thing I knew, I was completely naked in a hotel off the side of the freeway. And I have no idea what happened between that moment at maybe like 8 p.m., 7:30 p.m., somewhere around there, maybe, and to like the next morning at, 7 a.m. And I remember feeling like I've never felt before in my life. I was in a complete daze and I was so confused. That whole day I had like, I couldn't kind of piece anything together. I didn't eat a single bite of food. I could barely drink water. I was kind of like in this fog. And even my roommate was like, what's going on with you? I couldn't like voice what was happening. And I didn't really understand until I didn't sleep that entire night. And then I kind of realized after I started playing over the events in my head, I was like, oh my God, I know exactly what happened. And so I went straight to work. So I think that was a Saturday night into Sunday where I was kind of in that like after days. And then on Monday morning, when I was the chief of the service, and I went and talked to our chief, Dr. Donovan at the time, a wonderful man. And he was like, he took care of me. He got our junior resident, Pavlina, to take over my position. And they sent me to I had to go to the police. I had to go to OBGYN. They got me into a therapist, and they just gave me an entire week to just kind of like be in a container where I could heal. And so I have to like give so much props to my program. They were incredible in kind of giving me a soft place to land and taking care of me. And then also taking care of the work that I was leaving for that 1 week where I wasn't present.
Right. Wow. Yeah. No, that's incredible. And I'm so sorry that this happened to you. You know, we don't want this for any women, let alone, I can't imagine being a fourth year resident at the time as well. Now in your healing phase, certainly kudos to the junior resident who stepped up. Do you feel like that the culture at your program was set up in a way to kind of support a resident in duress, in need, if they've had a crime committed against them, for instance?
I don't honestly know how to answer that because I could only speak to my experience. And I know of other residents who have gone through my same program and not had great experiences. It was like the perfect storm of compassion, honestly. Like I had a compassionate attending who I had to go answer to. And I had a compassionate junior resident who was like, let me step up. And, you know, and she's the exact kind of person who is very similar to me, who's very like, I'm not going to subscribe to the vertical power structure and like the hierarchy. Like I'm going to take care of myself. This is nonsense. This whole abusing and like the beat down trickles down kind of a thing. And I very much felt that way. And so that was against a lot of probably the culture that many of the other residents and attendings subscribe to. So maybe if I had been on a different service, it would have been a completely different outcome for me. I just happened to have like the best case scenario.
Yeah, that totally, and that makes a lot of sense. I do want to say for people who haven't like been on rotations yet or, you know, seen how these services work, that makes a lot of sense. And it's so true how like one attending, the attending who's on the service that you're on, you might be on there for a month, 2 months, maybe 3 months. I mean, that person does have an enormous effect on really your whole life for that set of time, let alone when, you know, for lack of a better word, when you really need your attending or a coworker of yours to show up for you, like it matters a lot who the attending and of course who the rest of the team, who the junior resident is. Cause I can think of like junior residents where let's say that there is something like a loss in a family or something like that, and a resident's going to be out. There are residents who step up to cover, and then there are other residents who are like, that's crazy because my grandma died and I came to work. So, you know, like, suck it up.
Yeah, exactly right. It's one of those things where I'm like, wow, like all the stars were aligned or whatever it is.
Do you think that, like looking back, especially now, because with the gift of hindsight and so many years separated from training, do you think that 1 week off of clinical responsibilities was a pretty fair middle path forward? Do you think that there are things that you would recommend, like if you were in the position of power, would you do it that way for the resident? Or would you say, hey, maybe we should look at longer than 1 week or anything like that?
Yeah, I think I would probably do it on an individual basis, but that happened to be perfect for me. I mean, the first thing I did was I called my best friend who lived in Wisconsin, and I was just like, bat signal, like I need you, like get on the next flight. And she like flew in and with like a hairbrush and just like crawled into bed with me and started brushing my hair. And it was like, that was what I needed. And then the secretary of my attending at the time is just like a love. And she just like welcomed me into her office and shared her experiences with me, which every woman of that era has had some sort of experience of some form of like sexual inappropriate behavior or assault. And so she was, you know, there to kind of take care of me. And after about a week of kind of healing and dealing with it, I kind of wanted to just go past it. Like I didn't want to be in there anymore. And I think for a while, I didn't want to even pay attention to it. It took me a couple of years to really process through. Part of me wanted to just shove it in a closet and not look at it ever again. You know, they were like, do you want to press charges and go find out who? I was like, I don't ever want to think about this ever again. Like, I don't know what happened. And part of me feels like I'm happy I don't know what happened to my body, but there were two men there. Like, I have no idea what or who was doing what. And I honestly don't want to know, but the body keeps the score. And to this day, you know, like certain things like give me PTSD responses, or I have this like fight or flight response very easily in certain situations. And I have learned to kind of lean into that and kind of love that part of just like, I got you. Like, I got you, girl. It's okay. And like put like a hand on my chest and like comfort myself. because I know it's just kind of like a response to that. But another part of me wants to just, numb it, get away from it as fast as possible because it's so uncomfortable.
I mean, that's really incredible. I do certainly really personally love and recommend the book, The Body Keeps a Score, to anyone. I think that that's really true. And I've read a lot about, I'm very touched by the beauty of it when people are able to recognize those parts of themselves and say, hey, this response is one that my body developed to protect me.
Yeah.
And I love my body for that. Even if it's not like the response that we need right now, I'm not in danger right now, but I get where this comes from and I hold love for that part of me. Absolutely. I have, I think that like my journey with hypnosis has touched on like some of those themes, and it's just like, but I don't know. I don't feel like I'm killing it. I'm really in awe of you and like where you're at with the ability to love.
Yeah, it's a practice. Like I think if I had my dredgers, or if I had like some sort of power in academia, I would be like, yeah, every resident is going to do a practice of loving kindness for themselves. Every morning, you're going to put your hand on your chest and you're going to say what you're grateful for and say what you love about yourself.
I love that.
Yeah. Just little things like that I think we're not taught. And even just, like when I go into the OR, for example, I never enter an OR without anxiety. And I used to have shame about it or feel, be anxious about my anxiety. But now I'm like, let me just enter an OR and I'm like, oh, there you are. And I almost think of it as like a little animal. And I just put her like in my pocket. Hi, my daughter. I just bring her with me and I'm like, listen, you're not driving, but you get to come along and I love you and I know you want to protect me. And because it's always looking for, danger. And if we associate anything with danger, so if we have a complication and we're like, oh no, like now the OR is dangerous, that part of us is going to come up and try to veer us away from that situation. And unless we kind of take the wheel and like get into our executive brain and kind of understand it and love it, lean into it, then we're going to cause ourselves problems. Like comes out sideways later, right? It's like putting a beach ball underwater, it pops up in your face. So I've decided like, that's where I'm like, my heart's on my sleeves. I don't want to hold any secrets. I am exactly this way with patients as well. And I think this is maybe even a path to healing residency programs, is just like having an open, candid dialogue about this kind of stuff. Because if it's happening and we're just ignoring it, now we're creating secrets and lies just lead to badness. Like truth is always going to lead to a much better like resolution for everyone.
Honestly, I'm here for it. I would join the cult of Mel. Like I would sign up. I'd be like, I would join like that department. And like, imagine if Grand Rounds started that way, like a moment of compassion. Yeah. It's hard to imagine, but I think a lot of things are hard to imagine until somebody starts doing them. And I relate a lot to what you say because I do experience anxiety, going into the OR at times. And I have never heard anybody say that ever. I mean, well, actually, sorry, let me correct myself. I've never heard a surgeon say it. I've heard tons of people who work with surgeons say it because they're like, I have no idea if this like sociopath is going to scream or not. But I have never heard a surgeon say it. And so again, like, I mean, that means a lot. And then that gives me enough bravery to at least say, okay, well, I guess that's true. I guess I definitely can feel where you're coming from. And I love making it like a cute animal that could be with you. Cause honestly, if that were allowed, I would bring one of my cute animals like into the OR with me. And that would be very soothing.
There you go. Yeah. It's this pluralistic ignorance. I mean, I think that's what we're all speaking to. I mean, pluralistic ignorance of where we all think we're the only ones who have been sexually assaulted because we keep it quiet. And shame and isolation leads to desperation. And that's when, physicians hurt themselves because they think they're all alone and they're not. It's a pluralistic problem. It's everywhere. It's ubiquitous. Same thing with imposter syndrome and anxiety and mental health issues, with working surgeons who are just terrified of talking about it because of like repercussions from the board or what their peers are going to think of them, what patients are going to think about them. And I will tell you, as someone who is very open about my own mental health, and I talk about it on my podcast, I talk about it with my patients, I have never felt so connected with my people. And even with like I'm going to be leaving my practice at the end of the year and going into direct care. And all of the conversations I have with my patients, they're like, where are you going? I will follow you. I don't care how much it costs. It's like further showing me that, like being real with somebody, giving them transparency, authenticity, and honesty is needed. And that's not just a patient physician. It's also attending resident and residents like scrub tech and circulator and nurses and everybody. If we're all just TAO is what they call it. That's what Martha Beck calls it. Transparent, authentic, and open. It just makes everybody's life better. It's also like the Tao.
That. Yeah.
Yeah.
Well, but it does take confidence. It takes bravery to do that.
Yeah.
And it requires a lack of ego, which like a lot of physicians, surgeons especially, just do not have access to. Like, I mean, they could with effort, with intention and with effort. I'm not saying that, but I'm just saying in terms of like on their regular days without putting effort into it, I don't think that that's like a skill set that we cultivate in our young surgeons. And it's not one that we model. So, that's that's a theme that we do talk a lot about. I call it big dick energy. Because, and then, but like of course, the opposite being like micro penis energy. And when when somebody at the hospital is like acting up, they're screaming at other people, they're making other coworkers cry and things like that. Whereas like true BDE is like, welcoming of questions, the TAO method. Like I do think that those all are on the other end of the spectrum.
Yeah, I loved your whole interview with the Bachelor, the pilot Pete, right?
Yes.
Yeah, because I was like, oh my gosh, like how did they figure it out? And like we didn't figure it out. It's like the whole idea of humans are meant to be perfect. That's like the elephant in the room is like we expect you to be perfect, but perfect is unachievable. And so when you fall short of that, we're going to beat you. And it's like, totally. And I mean, so how is, if you're raped and it's like, what, you're not, maybe you had a couple of drinks or you're wearing a skirt. And so now you almost like, as women, we own that. And now we're like, okay, well, I can't talk about it because I made a mistake. I didn't show up like completely covered from head to toe with no makeup on, to like
well,
church.
You shouldn't have shown up. There. Like, you didn't leave the church. Like you should have just been in church the whole time. So it's like you wouldn't have even been there. Yeah.
Yeah. It was not my fault.
I do think that one element of your story, well, exactly, of course, like, and not your fault in any way. Like, obviously, I feel like we are kindred spirits and we get on. But like at the end of the day, I do feel like the need to say that. Like I have to remind everyone in no way is that your fault. And for me, parts of that story bring up even a tangentially related topic. You've mentioned like the pursuit of pleasure and the escapism of the resident physician. And I got to tell you, I don't think I took one in-service in all 5 years where I didn't get blackout drunk afterwards. And I'm talking like, the residents go out afterwards. That's like that's the cultural norm. So we go out. It's a stressful experience. Also, residency is so stressful. And then you have this 8-hour exam day. The in-service is an 8-hour exam that we take at the hospital. We go on a Saturday to do this, like usually on a beautiful spring day. And then when you get out of the test, a lot of the crew meets up and goes out drinking. And, there's a lot about the intersection between like alcoholism and residency training that also like it all is part of this bigger conversation of how our residents live too, and the dangerous situations you can get into. Like, it's kind of a miracle. I mean, I am 6 feet tall and like 175 pounds. So it is hard to alcohol poison me, but like kind of a miracle that I didn't end up in the hospital after like in-service partying.
Yeah, no, my roommate actually one of my roommates ended up in the hospital with alcohol poisoning, like on vacation. And Yeah. I mean, I was the same, like we just go out and just try to numb. But like that particular night, I was completely like walking, talking, completely feeling fine. And then next thing you know, it was like the next morning. I know for a second I was like, oh gosh, did I like get totally black out? I was like, no, I had like 2 drinks, 2 or 3. I was like, there's no way.
Yeah.
But it definitely is part of the culture. And that was something that, as I it was weird because I almost started to feel like when I was with peers, that started to make me feel unsafe. And I wanted to start to pleasure seek and like numb away. Like meetings to this day, I can't do. I have a very hard time with because I almost get like severe anxiety because it brings up this like past experience. And so I try not to go to meetings as often as I should probably. But when I do, it's challenging.
Other things like, I know it sounds so corny, but I kind of think like crystal shops are a vibe. I like them. I mean, the rocks are expensive, but like kind of a vibe. And I got to a point in my journey and my career where like I cannot afford to not try everything. So that's kind of like the open-minded philosophy where I'm coming from, where, I like a crystal shop, and some of the ones, are more like meeting specific or like, charisma, like the charisma that you could bring to a meeting. So then I pay like $3 for a little stone, and it's beautiful and it's very soothing and it fits in a pocket for like meetings. I still have to go to a fair enough number of meetings that like, I'm going to carry my little rock with me. Like, you're not going to touch me. Like, because yes, exactly. I mean, it is anxiety inducing, and that's pertaining to a lot of, different experiences in residency where they'd lock us in a room and just, like beat us up metaphorically.
Yeah.
So anyway, just kind of a couple thoughts. And, even if people were like on the fence about trying out like a crystal shop, I mean, what do you have to lose? And a $3 rock is not such a horrible price to pay for, a little peace of mind going in. You don't want to do at work.
And it's so good for you. Like, absolutely. Use your rock, like meditate. I love meditation. One thing that I think is like the most beneficial thing that I can't believe we don't offer this in residency is coaching, because it really is like your thoughts create your feelings drive your actions produce your results. And if you start to understand and pay attention to the thoughts in your brain, and you're able to just kind of like allow urges when you're like, oh, here comes an urge to like do this or that, because I have been feeling awful and my body just wants to feel better. And I can create that feeling with my thoughts. And then you can just use your internal instead of using like external things, whatever your pleasure thing is of choice, like porn or eating or drinking or like binge watching Netflix or vacationing or overworking is huge. Like work is a drug. I think that's the big drug transfer from like residency to actually working is like, now you're just going to overwork, and that's your new like dopamine hit. So it's like one of these things where you don't have to seek the dopamine hit. You can actually sit quietly in a room and like decide how you're going to think, and then create feelings from there. Like that is the most powerful thing I can offer anyone.
I love that. Well, and, I even feel some resistance to that. I'm like, well, sounds great. Would I want to sit in a quiet room right now? Like, not really. In part because I have had like a long couple days in the hospital. So I really do not feel like it. The Netflix sounds pretty good right now. But it's funny because it reminds me of like, I've in my past life done like FEMA grant funded studies on bothersome tinnitus, like in firefighters. And so that was back when they were looking at like mindfulness-based stress reduction, those types of practices and interventions. And literally one of the prospective randomized control trials was one arm was putting these people for like 8 weeks consecutively into a mindfulness-based stress reduction practice, which meant taking bothersome tinnitus patients and putting them in a quiet room for an hour, like twice a week. And I mean, talk about someone kind of resistant to the experience. Like we just had to kind of usher them in there, but it really, I mean, it works. That's evidence-based, treatment, but no one likes it at first.
No. And it's simple. It's like simple isn't easy. Just like it's simple to like lose weight. Is it easy? No. Is it simple to manage your mind? It really is, but it's hard. It's not easy. Just because the solution is kind of simple, like actually pushing yourself and getting over that hump, that like inertia of doing it is hard. It's way simpler for me to think back to my experience and like, again, shove her in a closet and not look at her and be ashamed of that person. But instead, every single decision, all of the bad ones as well, I can love myself all the way along the way, knowing that every single decision was made in an effort to protect myself. And that is true for everyone. So if we look at it from that vantage point, like that is where I have like villain compassion. We look at the people who we see as like abusers in residency or who are like malignant, or this person who decided to like drug me and do whatever he did to me. Like, I don't know what his life experience was where he felt like that was a good choice for him. And everybody, like, we're all babies once. We're all just trying to feel better. And absolutely, there's no way, no excuse for anybody to hurt anyone else. But if we look at it from that perspective, we don't other people. And because I think that's where we get into a problem, when we start to otherize everyone, and now we're dividing ourselves. But we're, at the end of the day, we're all just people trying to feel better. So how can we find some compassion for each other, and even like villain compassion, so that we can actually like make productive steps to better everything?
Yes. And I definitely I really admire your ability to have so much compassion for yourself, for others, even for the villain. I would like to play devil's advocate just for like a minute, because you almost lose me at villain compassion a bit, because here's what I think is very troubling to me, was troubling at the time. I kind of remain troubled about it, but the hierarchy, the power dynamic issues, because when we are talking about things like, or, what my mind goes to when you say villain compassion is, yes, I think of myself as like a resident physician, kind of powerless against, a senior resident who was a huge bully, and kind of like beyond a bully, because he was doing a lot that would go on to plant seeds to cause trouble for years and years after he left.
That's awful.
But just kind of like a bully. He's like Joker levels of, I honestly don't know if there were like any personal beefs. It was just like wanted to watch the world burn for an unclear reason. But there was bullying there, and then attending mistreatment towards residents. That was very not uncommon enough. And the issue in those setups is just that really, really unhinged, like kind of beyond normal. It's approaching like, when people talk about Me Too in Hollywood.
Yeah.
Like Weinstein, right? Like your career depends on often this person's approval, feedback, ratings, keeping you in the program. So
yeah, I hear you. And like, I will give you a framework that I think will be so useful, and I think will be useful for your listeners. So if you think of Stephen Cartman's drama triangle, this is from like the 60s, you have 3, and this is what every human enters into one of these roles, and you circle around this. And we love drama. That's why we watch The Bachelor. That's why we watch like reality TV. But it's not helpful to have drama in our own lives, and we don't have to. So there's a victim, there's the villain, and then there's the hero. And it happens all the time. So if you come home and your husband's like, oh, you look tired, and you're like, I had a bad day. And then he'll try to hero you. And let's say you don't want to be heroed. So right in that moment, you're the victim. And then you're like, no, I don't want you to do anything for me. I just need to be left alone. Now he's now the villain, and now you're the victim. And so it's like, you just spin around, and, like patients do this all the time when they come for a second opinion. And they're like, oh, that doctor screwed me up. And they're inviting you to jump in and hero them. And as physicians who are very much in our egos, we love to do that. But then we can very quickly become the victim if they don't get better. The villain if they don't get better. So, right. So there's this so you spin around, victim, villain, hero, victim, villain, hero. You just keep spinning around. And I have decided I don't want to enter that. Okay. And I don't. And so that is the exact example of us victim, playing the victim card and then saying that person's a villain who hurt me. The way that we can up-level it is David Emerald's The Empowerment Dynamic. I always want to call him Ted, because TED is The Empowerment Dynamic, but it's from this guy named David Emerald, and it's genius. So the victim becomes the creator, the villain becomes the challenger, and the hero becomes the coach. So in like a patient example for like if somebody comes to you and they're like, hey, this other person screwed me up. This he's a villain. He's awful. And they're like, you fixed me. I heard my neighbor said, you fixed them. Now you fix me. I will say to them, okay, I hear you. I see that you have this problem. This is what I can do. And this is the result I think I can create. What are you going to do about it? What do you want to do? So now you like put it back into their hands and you coach them and you don't step into that drama triangle with them. And I just had also another example when I was away in Montana where like a little kid fell into the water, okay, into like the rushing Blackfoot River. Mm-hmm. And so that kid needed saving. The parents were nowhere to be seen. And I see the kid panicking and I'm like, oh my gosh, like, I don't want this kid to drown. So I go in and we form like a chain to get the kid out of the river with some of the staff. Meanwhile, my friend is having a conversation with the mother of the child. The mother is saying, I feel judged because you were yelling that I wasn't here watching my kid. And my friend is like, well, we are judging you because your kid fell in the water. And so then, you know, it's a small community. Later on, I walk in like in our tent area and they're like, oh, hero. And I'm like, no. You know, it's like we're vilifying this mother and people are trying to heroify me. And the whole time, you know, my friend is like, that mother is awful. And I'm like, she's not. That is just her opinion. That is not a fact. So I think we can always stop ourselves from entering in the drama triangle because it goes nowhere. No matter what situation you put it, if it's residency, if it's, you know, anything, anytime you play the role of victim or you try to play the role of hero, you're going to swim around in that triangle. And that's not to say that like, if you are a true victim, some people are true victims. Like I was absolutely victimized at that time. Okay. And I needed time to hold myself in like a really cozy cocoon to process those feelings. And I was a victim. But then I was able to go through it and I didn't have to do that while attaching myself to anger and, you know, shame or anything like that. I can just release it and be free. And it's like, that was just an unfortunate thing that happened, that a very troubled person took action from a place that I don't quite understand. And that's not mine to own. That's his.
That's incredible. Yeah, I love that. And I think that that's a helpful way to think of it, like stay out of the triangle. I'm definitely a person where, especially if I'm going to be activated or something like that, I need my mantras to be like pretty short, very chewable. Like, so something like stay out of the triangle, like that would work for me because it would give me enough of a second to be like, there is a triangle. You don't want to swim in it forever. Like this is our one life to live. So I really love that. Thank you for sharing. I will say that, you know, the second opinion consult, I mean, I was somebody's third opinion earlier today. So yeah, I mean, certainly, I know we all see a lot of that. And I immediately, like even the second I got out of residency and started seeing patients on my own, I was like, I know I do not want to get into this with them. I didn't have such an eloquent, like a beautiful framework for it. I didn't know the triangle was the triangle, but I will say that like that feeling of them being like, yeah, this person like tried to kill me. You know, the reality is that 99% of doctors, probably 99.5% of doctors are not trying to kill patients. So like when they do start, you know, talking in black and white or being like, well, yeah, this doctor was just like terrible, but I can see that like you're good and I can see that you're going to fix me. Like you're one of the good ones, right? I do not engage in that at all because what it's kind of reminiscent of is like the guy who says all of his ex-girlfriends are crazy. Mm-hmm. Right. And he's like, oh my God, they were so crazy. Like all those girls, they were just the worst. Like they were nightmares. They were toxic. And it's like at a certain point, you know, you learn not to engage with that because like at what point, like you mentioned, there's nothing protecting you in that scenario from just being the next villain. Like yes. The next crazy ex-girlfriend, the next doctor who this patient hates. Like they, you know, these things are fickle. And so it's so funny. I can definitely see what you're talking about. I've seen doctors fall for that before and jump into the hero. Like, no, that person just does not know what they're talking about. They weren't fellowship trained and I am.
Yes.
So I'm about to fix you. Like, you're about to be healed. And then, like the patients are not probably statistically significantly more happy with those.
No. If someone said that to me, I'd be like, your ego is showing. Like, no, thank you.
Your micro penis is showing.
Yeah, whatever. Yeah, no, I think the feeling. We all know that feeling of when we're being pulled into the triangle, but it's so nice to have a language for it and then be like, oh, even my son, I always call him, he is like such a villain. He could be, but he's a challenger. Like he'll say things like, why do I need to learn math? We have a calculator. And I'm like, well, you're not wrong. He's going into 5th grade. He's like, what's the purpose of this? Am I really going to be doing like long division and when I'm actually out in the real world? And I'm like, no, you will not. But you will be the only adult human who doesn't know how to do long division. I was like, are you okay with that? Little things like that where I'm like, I struggle with him and I see him almost like challenging his little sister. And I'm like, it's okay. He likes to be the challenger. And we need challengers because they're the ones that show us what we value. We would not know what we value if we didn't have people challenging those values.
And it is reminiscent of, the Joseph Campbell hero's journey, which I know we're not talking about like us trying to be the hero in the triangle, but like in a different sense, just where you're the character in your life. Threshold guardians are like kind of a fancy name for these figures. Like they make us better. They challenge us. So they're this same challengers category. There's like a million different ways to chop it up, but like growth does not occur in their complete absence. And in fact, when you look at stories, threshold guardians are literally typically like they're at the threshold. Like you have to beat them. They come right before a major transition or growth period.
Yeah. Yeah. We need them. We can't just be coaches and creators. Like we need some challengers. So it's like, I encourage everyone to look up Stephen Cartman, Drama Triangle, and David Emerald's The Empowerment Dynamic. It's a life-changing framework.
Well, that's incredible. I do want to, you and I have connected on before, like the Adlerian psychology, just specifically how all people this is a hypothesis, right? Mm-hmm. So all people treat others either horizontally or vertically. And that just means that like I myself, either I'm a horizontal person or a vertical person. Because what a lot of people try to do, I think, especially in medicine, is that they try to say, I extremely believe in the hierarchy at work. Like we're vertical, like you're a PGY 5 or you're a 3. And like 3 is lower than 5, 100% of the time, But then those people will say, but then you'd ask them, you'd be like, do you think that you are better or worse than all your friends? And what about your siblings? And they'd be like, oh no, like we're all horizontal. The vertical aspect is only at work. Well, I really like how in this psychology, they argue that you can't split it up like that. You can't like pick and choose. Like fundamentally at the end of the day, we as people, everyone makes the decision for themselves. Do they believe all relationships are vertical or all are horizontal? And so what are your thoughts on that?
Oh my gosh, I am absolutely a horizontal person all the way. I always have been, and I will never like sway from that position. I mean, I really believe in my heart of hearts, like in my bone marrow, that every human being is equal. Like we are just absolutely equal. It doesn't matter if you are the leader of a country or like a homeless man in a box, like we're all just equally worthy. It's just whether we recognize our worth. Doesn't mean we produce the same kind of like benefits for the world. Some of us do much more things that are helpful for others and some of us do nothing, but doesn't mean we're not worthy. We're all equally worthy. And I've always felt that way as like, with residency, I think of residency as almost like a militaristic, like cult-like thing where you take all of these different people and they come in very different with other idiosyncrasies and you put them into a container for 5 years and they come out more alike. And that is kind of why the power structure is useful. And that's the same reason why it's useful in like the military. All the soldiers go in different and then they come out with shaved heads and they all can like move as a unit, right? And I think that's the idea behind it because you want to keep, and they say for patient safety, right? You want to have everybody doing some sort of standard of care for surgery. I get it. I get why it seems useful, but it can be done, I believe, while also having complete respect and compassion for every single human being. And as a mother, I have an almost 9 and 11-year-old, like absolutely is a very I had to tell my husband this. I was like, listen, no more power struggles here. Like, do not go there with our kids. And I think our kids like really see that because we value their opinion. We value them as individuals. And even though they're in different, they're not going to offer up as much things that are going to be useful for our family unit. I still get down and like, hey, what do you think about this? Maybe it'll be, it's like their opinion doesn't matter, but I'll still hear it. I'll acknowledge it. I'll validate it. And I won't tell them they're stupid or dumb or beat them down or, like if they have a misbehavior, I'll try to understand. Like when my daughter was having like tantrums or whatever when she was little, like I would try to understand it and not try to say it's like abnormal. It's almost like normalizing every stage. Every single stage is going to have some ugly sides. That's totally fine. It doesn't mean you have to tell that person that they're less worthy or that they're worse than you just because you've come out the other side.
Yeah, that's really beautiful. I love that. That's awesome. I mean, I think that back in the day, maybe like the generation I was growing up in, probably not a ton of horizontal parenting, but like it's really beautiful to hear about. And I'm interested to see the types of, self-actualized adults that it produces.
We'll see what happens. My kids, it's like a little living experiment. Come check back with me in the decade. Yeah.
I love that. Well, I did want to share, as we're wrapping up here real quick, I want to share just like one quote and then we'll go over one resource that we're going to have in the show notes. In terms of this resource, the AMA Journal of Ethics did publish in 2018, like just some nice guidelines for sexual assault and sexual harassment in medical training. And it's like a nice primer. Again, we're going to have this in the show notes, but they do make the point and just the reminder that so like other sexual assault victims, medical students and trainees can report to the police, but under Title IX if they are assaulted by coworkers, which would be a fellow trainee, attending physician, or other hospital staff. And they also have the option of reporting to medical school or hospital for formal investigation and adjudication. That's just kind of a reminder and PSA. We'll put the full primer down there. Another article that stood out in the kind of very little that's out there in the realm of sexual assault and sexual harassment for medical trainees specifically, there was an AAMC news article where I liked this quote from Timothy Johnson. And he said, "The greatest predictor of sexual harassment is perceived organizational tolerance. To really move the needle, leaders need to make explicit statements about sexual harassment, including appropriate and escalating disciplinary consequences for perpetrators who violate harassment policies." Yeah. And I would argue, certainly holds true for even sexual assault. Like I think that that's true about anything. Like the greatest predictor for any bad behavior is going to be the perceived organizational tolerance for that type of behavior. To finish up here, I want to close with the question I ask everyone, but do you believe in karma?
Yes. I had to think about it, but I was like, yes. Because every single time I pay a bill, my husband's like, this costs so much money. I was like, everything we put out will come back tenfold. And even when I'm at like Whole Foods, I'm like, I am not going to make this non-organic. I'm going to pay for the full organic thing when you're at self-checkout. No, I think there is something to be said whenever you're being honest in the world, even when people aren't watching, that it will come back to you.
I love that. I hope that's true as well. And so I'm truly so grateful to you for sharing your story with us today and also so much of your wisdom, because I learned a lot of awesome tricks and tips to kind of like reframe my thoughts into more effective thoughts, which that's very beneficial. I definitely think that's like the recipe to win the game here. So where can our listeners find and connect with you online?
You can find me on Instagram at _surgeon_coach. And my podcast at Surgeons with Purpose, and then Mel Thacker Coaching. And obviously, if anybody needs any help with anything, I'm here. This is like my post midlife crisis mission, is to like help every surgeon from the inside out to get through whatever kind of mental health or issues they're dealing with.
That's incredible. And we'll include all of those in our show notes as well, so you can find her info and click to connect down there. Follow me on Instagram at francismay.md and at Rethinking Residency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. I look forward to connecting with you on the next episode of Promising Young Surgeon.